Good day, Leading Age Nebraska. I'm Janine Fink-Boyle, and I am here to present to you linking your emergency preparedness plan to infection control. So we're going to go through PowerPoint slides, and we're going to talk a lot about your emergency preparedness plans, talking about the linkages with infection control and survey, and obviously how they all link and interconnect to COVID-19. So just give me a second while I share my screen and bring up the PowerPoint. All right. So as I said, we are going to be talking about linking emergency preparedness plan to infection control. Again, Janine Fink-Boyle. I am from Leading Age. I am the Vice President of Regulatory Affairs, and I think I've met lots of you at different times, and I wish we could all be together, whether it would be somewhere in Nebraska. But I come to you from Washington, D.C. on a really nice sunny day, and we are going to get right into it. So here's our learning objectives. We will identify, analyze, plan, and explain. We're going to identify your emergency prep regs. We're going to talk about infection control policies and procedures. Then we're going to analyze how you have an infection control plan and how that feeds into your emergency preparedness plan. We're going to talk about your drills and the risk-based analysis and how that actually is the core part of your emergency preparedness plan, and how both infection control and obviously with your emergency preparedness all are so paramount with COVID-19 and the pandemic. And then lastly, we're going to explain the intersection. So the intersection between emergency preparedness and infection control, and talk a little bit about survey process. So here's our agenda. We're going to start out with the EP rule. So it'll just be a quick overview. And then, And then we are going to talk about the elements of the EP plan. We'll be talking then about linking the elements and the different factions of the plan to COVID-19. We'll go into survey, focus on infection control, obviously a focused infection control survey, which I know all of you have had by July 30th and could potentially be in your annual survey, and maybe even having more focused infection control surveys. Then we're going to talk about administrative controls and operational controls, and how the controls that you have in your organizations feed into infection control and feed into your emergency preparedness plan, again, all around COVID-19 and the pandemic. So just as a little bit of a reminder, the final rules for emergency preparedness, they came out in 2016. And so that final rule was put into place in, I think it was September of 2016. And then with that, there were some additions, deletions, and some edits that were done in a revision to emergency preparedness requirements in 2019. And those were pretty small when it came to long-term care. It was just some changes to drills and how those are carried out. And then obviously there's always still the annual requirement. What differed really was for the other 16 provider and supplier types. So long-term care was one of the 17, but they had some other requirements that were edited and changed and revised in 2019. So as the emergency preparedness rules and regulations put forth, they actually then have a whole new compliance, and that compliance for participation in Medicare and Medicaid are their E-tags. So we're so used to seeing F-tags, so whether it's F880 or F253, well, there's a whole list of tags for the emergency preparedness surveys. And if some states actually do those surveys together when you have your annual, and some actually have specific surveyors that come out and survey for you. All right. So with the changes in 2019, the changes for long-term care, and I'm specifically talking about nursing homes, is that you had to review and update your plan, your policies and procedures, and your communications plan, which is part of the whole process. And that had to be done annually. Now, again, with some other provider types, there were some changes. The other part had to do with training and testing. And with training and testing, there are large-scale exercises, partly with communities, and then if there's not community, it can be facility itself, and then there has to be a secondary drill. And those classifications of the secondary drill do not have to be the large scale. It can be an opportunity, but you could also do potentially a mock disaster drill or a tabletop, or what they call more of a workshop. And we'll talk a little bit about that towards the end of the presentation, but that was the changes for long-term care in 2019. So your emergency preparedness program has 4 elements to it. The first is your risk assessment and your plan, and underneath that is your all hazards approach, and we'll talk about that in a second. You then have your communications plan, and that obviously is internal and external. You have your policies and procedures, and remember, the policies and procedures feed into the plan itself, what's going on in your environment. It also has to do with your policies and procedures for infection control. And then also when you get all of that together, you have your testing and your training. And so obviously your staff, whether they're full-time, part-time, consultant, contractor, volunteers, all have to be trained on your emergency preparedness program. And that program, as I said, has the components about your assessment and your planning, your communications plan, your policies and procedures, and that it has to be updated annually, and you have to do your training annually. The other part of the testing really is working with whether you have engineers or your maintenance or your environment of care individuals, and you're testing your pieces of equipment, you're testing the plan itself, you're testing to make sure that someone on one of your nursing units and someone in the dining area knows what to do in an emergency. And what emergency? The emergencies all go back to your risk assessment. So let's start here. Let's talk a little bit about where you probably were between 2016 and 2019, and sort of really now as you are looking at evaluating your emergency plan now during the pandemic. And I'm sure that all of you have been making changes when CMS comes out with new regulations and new guidelines, when the state of Nebraska does. You're constantly looking at what you need to review. So where do you stand today? Where do you stand right now? Going on in the environment, what's going on with CMS, what's going on with your Nebraska Department of Health. So you're reviewing your internal plans and policies. So are you up to date? Are you making sure that, and I'm just going to pull something out, if there are screening protocols for COVID-19 and disinfecting with infection control, if there is the communications plan, alerting residents, families, and staff. So we're reviewing all those plans and policies, and you've probably had to make some edits in the last 6 months. You've had to make some changes. You've had to make some revisions, all again following along. So when you do those, you need to then obviously document those policies and those plans and those procedures, and make sure that you are training your staff and you're alerting your staff what has been revised. Meeting with outside groups. I know you're not meeting probably in person, but virtual, whether you're working with acute care, whether you're working with home and community-based services, so hospice, if your adult days are open, any sort of home care, any individuals that, whether it's the ombudsman groups or anyone that you actually have some sort of plan with. So I think about the fact that lots of schools are closed and they're virtual. And so you might have a memorandum of understanding, and that memorandum of understanding might be evacuation to the local school or one that's right down the street or community center. Well, again, now you need to go and see what's going on. Is that closed? Is there any availability to even open those doors if you had to evacuate? So again, meeting with those outside groups, your external stakeholders. Looking at codes and regulations. So as I kind of said before, CMS is obviously putting out memos. I mean, I think they've put out over 20 different quality memos, and one just came up recently with testing, and now guidelines with visitation. And so are you making sure that you've identified anything, whether it comes from life safety, when it comes from clinical care, when it comes directly from CMS, or something that's in Nebraska, and you're identifying what it is and then making the revisions that are needed so that you're operating to be in compliance. Number 4 here, looking at your critical products, services, and operations. Now, I know as I stand here and talk to all of you that there's been shortages of PPE. There is now the testing kits are not available for your point of care testing. And there's lots of supplies that you need in your organization that are difficult to get, and that you have looked at CDC websites and looked at the burn rate calculators. But really thinking about, as we go into the fall and into the winter, what critical products do you need? We also have flu season coming. When you think about your weather, obviously your weather in Nebraska, are you making sure that you have different supplies that you need, whether it's food or environmental supplies, even if it's activity supplies, everything that you had, I know during the pandemic, it's, focusing obviously on COVID-19, but let's start thinking a little bit also about what's coming down the pike and the months that we have till the end of the year. And so making sure that you're identifying those critical products, services, and the operations, especially if maybe you weren't getting in a lot of rehab patients, less skilled patients. You had more of your chronic long-term care, but now more surgeries are opening up in hospitals. And so again, thinking about where you were 6 months ago, let's think about where you are now and what you need. And then lastly, identifying your internal resources and capabilities. When you're thinking about your emergency preparedness plan on an annual basis, so has to be some strategic thinking. Looking at maybe you're creating a new service. Maybe you are going to try a different supplier. Maybe you're changing a workflow or changing up your staffing. But really, let's talk about where we are today and how this linkage with your emergency preparedness plan goes into, obviously, infection control. You're thinking about your infection preventionist and how he or she is working in your organization. You're looking at redeploying people that are in education. You're looking at how people are cleaning and high touch areas. So really using those internal resources. And what I could say to you is what we heard from some members is that people that got laid off from their jobs, people that maybe decided to make a career change, but they're individuals that you could maybe bring into your organization, and they could be cleaning the high touch areas. They could be working in reception. It could be family members of staff that you have. But so what's the capabilities? Have cross-training individuals, right? Nursing assistants could do an activity in the evening, again, depending on your workflow. But really kind of starting here. Let's start in this environment. So as I said, I know that you've all done this on your annual plan for emergency preparedness, but what we're trying to do is we're trying to really look at it again through the COVID-19 lens. You're looking at through a pandemic, and obviously having that focus on infection control. All right, so as I said before, you're obviously, you've all done an all hazards approach to get to your emergency preparedness plan. So your risk assessment and your planning. So again, when you're looking at your emergency plan and you're looking at your risk assessment, it's everything that you have at your fingertips. So what is your environment? What is your weather? What could happen if you had to not have certain roads that were closed down, or in this case public transportation, or when I say the roads coming closed down, and thinking about risk assessment, not be getting certain supplies in. So you need to do a risk assessment, and that risk assessment really has to focus in on everything, including missing residents, including the fact that there are strategies to make sure that you have everything based on what could happen in your organization. And sure, maybe in Nebraska, you might not be looking at torrential downpours, or I should say hurricane, but I know that you've had floods before. And so really taking that all into consideration. If you are unable to get to an acute care hospital for an emergency situation, what are the risks that could happen? So again, this all hazards approach. And from that, starting to develop what your capabilities are and what your capacities are in your organization. So again, it's not just the supplies, it's not just the staff, it's also the environment. It's also your physical space. And so once you kind of think that out, it's like, well, where are our missing links? Where are our holes or our gaps? And you have to think about that. It's any cooperation or collaboration that you can do, again, in the community. So working with other nursing homes, working with acute cares, working with home and community-based services, is really thinking about how can you provide services during an emergency if in the case of there has to be continuity of your operations, including any sort of authority. So thinking about succession planning. So all of that has to be, part of the cooperation internally and externally. And then obviously you're going to do an annual update. So when I keep talking about the annual update, I would assume that you might be on your way to be doing it, or you might have done it before the pandemic, but you've made so many revisions during the pandemic that this should be all part of your process. Okay, so we just talked about the risk assessment. Again, the all hazards approach, internal and external, again, and we're thinking about people, you're thinking about your resources, your supplies, and you're thinking about your residents. External goes again along hand in hand with community, but external could be vendors, it could be contractors or consultants that come into your organization, and then obviously working with your community. So again, I keep talking about schools and home and community-based services, but it could also be churches, it could also be businesses that you work with, and then the environment. So the environment, again, really focuses on the weather, it focuses on public transportation, transportation period, so roads and so forth, ways that you get supplies in and out and people get to you in and out. So again, that whole part comes in as your risk assessment, which is part of your emergency plan and really formulates where you're moving towards. So policies and procedures. And so here is really where you kind of dig in deep. And I think that when you look at emergency preparedness and you're looking at your plan, sure, there are areas of it that you are going to actually have to create a new plan or review a plan that you had, but you also are taking plans and policies and procedures from other areas too. So this is where we start linking in infection control. So first, just talking a little bit about communication, really focusing in on what is your communication strategy? How are you communicating with your staff? How are you communicating with your residents? How are you communicating with your families? So what we've seen now, really looking during the pandemic, is obviously there's a requirement. So through infection control, there's another new FTAG, and that communication is making sure that when you have positive cases of COVID, one positive case, that you have to communicate within 24 hours to your families, your residents, your staff. And so again, that's part of your emergency preparedness plan. So you've probably done some revisions for that, but you're really thinking about that communication plans, the communication plan that you have. Is how are you doing that? Are you making phone calls? Are you using some sort of internet-based solution to send out? Is there a newsletter? Is it an actual letter that you're writing? You know, obviously for HIPAA reasons and so forth. But really making sure what is your plan, who is responsible, and then who's the backup, and then making sure that you have the right timelines. When I say about resources and assets, so again, looking at the resources that you have, making sure that, again, disinfectant, when you're doing cleaning, when you're using any of your PPE, so any of that. So again, whether you use the burn rate calculator, whether you are, you're doing screening and then you're doing testing. And so all of those pieces that you need, is there someone that's overseeing that? And then obviously, again, going back to infection control, there are new FTAGs that have to do with testing and reporting that fall into some of your compliance. And so with that, you need to make sure that you have your resources and assets. Safety and security. So again, I know I talked about, excuse me, a missing resident, but anything that could kind of break that barrier. So whether in this case, as visitation, and we're not gonna discuss visitation, but if visitation opens up and you're doing indoor visits or outdoor visits, the safety and security of those visits, and what are your policies and procedures, time limits. So many individuals that can be here at a time for visits, thinking about the safety of the other residents walking through the building, is there signage and so forth. So really, again, focusing on those infection control pieces that really kind of drive, in this case, the policies and procedures. Staff responsibilities, we talked about succession planning, but make sure there are clear roles defined, making sure that there's a system to track individuals too, whether they're on duty in the organization or if you have to sheltering residents, that there's a tracking system. If there has to be evacuation for some sort, in this case, where individuals are going and how are you documenting their medical record and their medication. So who's responsible for that and how that's going to work. As I said, with your medical documentation, preserving the resident information. And then in the case that you have volunteers, what are the volunteers' roles? And then how will that play out? When you're thinking about utilities, again, if a utility is somehow cut off because of a storm, do you have, your backup generator, you have, how many foods day supply of anything that's non-perishable, water, linens, think about that. And then what about the dirty linens? How are those going to be cleaned if you don't do your own laundry? So you thinking about all of that. And then the clinical support. So in the case of, again, I talked about emergencies, getting to an acute care hospital, if you need to have a dentist come in, or there's an emergency that might be not medical, so I think about eye, ear, and your teeth. How is that going to work? Clinical support is also your dietitian, social workers, activity staff. I know it's not clinical direct hands-on care, but thinking about the social and the emotional and spiritual aspects. And so again, all the policies and procedures, but as I said before, you're not creating new ones for the emergency preparedness plan. You are working on what you've already done in your organization, incorporating them into your emergency preparedness plan again, and then making sure that everything is delegated to the staff who's responsible. So communications plan, again, I talked a little bit about it before, so I won't dwell on it too much, but again, how are you sharing information? How are you actually getting the word out? How are you coordinating resident care? So again, I think about whether it's medications, whether it's particular treatments, whether it's, again, an eye doctor, whether it might be a psychiatrist, but again, coordinating that resident care, and then obviously your activities of daily living. So what's happening, again, every shift with your nursing assistants and your licensed staff, what's going on with activities and social work, so coordinating that all together, and then documenting it. And so remembering you have to have that communications plan so all the pieces are in play. Your testing and training program. So as I said before, once everything is put into place, policies and procedures, or anyone that's revised, you want to make sure that you maintain your testing and training program. So if there's going to be initial training when you have an employee that comes in, or again, a new staff member, but then you have to do your annual testing and training. And remember, this should also include anyone that's under a contract or any other arrangement, any volunteers consistent with what their expected role is, but really making sure that you have a testing and training program, and then you are having your staff demonstrate their knowledge of it. So they're being tested on it. So whether it's in online testing or demonstration, you're doing that annually. You're conducting drills and exercises. And so with that, again, what we talked about before is that for the emergency preparedness regs, this is your opportunity. So here is the biggest linkage in this presentation that you're going to get. And that has to do with you actually have a drill that's not a drill anymore, right? So you're in the middle of a pandemic. You are experiencing the positive cases, or preparing for the fact that you might not have any cases, but you potentially get one. So this is for you a full scale. So it's a full scale. In your case, could basically be community-based or facility-wide. So part of what I wanted to really convey in this presentation is that you have the ability to use the pandemic as your disaster. In this case, it's not a drill. It's exactly what you're doing. And so really this gets down to what we talked about is your communications plan, your testing and training. It is making sure that all of your staff are aware what's going on, if there's any revisions or any training. And so you are really taking into stock what you're doing on a daily basis. You have to analyze any of the responses that you've done. So as you've had to change course, so testing, visitation, screening, all those different pieces that you've had during COVID, with infection control, how you're doing your disinfecting and your cleaning, all of that is be part of your particular participation in the pandemic, excuse me. And then obviously I said test. So with testing, again, right now you have to do, 2 drills per year, and one could be a tabletop or a mock drill or a second full-scale exercise. In your case, obviously you have already the pandemic, and that would count. But your second one, you could think of something else as you move through your annual. So I could have probably just moved the slide here, but as I said, so in order to meet the requirement, there's an annual full-scale exercise, community-based or facility-based. And then the additional one is either a mock disaster drill, a tabletop workshop where you sit around the room and actually kind of have a particular exercise and do group discussion, and then there's a narrator, and you can have clinical relevant experts involved in it. And then obviously you have to do prepared questions and make sure that you're really looking at your emergency plan. Or you could have a second full-scale exercise. So that's part of the program. So again, as I said, this is the biggest link in the presentation, is where you are currently within the pandemic and what you've been working on as part of your emergency preparedness plan. So the training requirements. So we talked about testing, and we'll talk a little bit about the training requirements. As I said before, initial and new and existing staff, and it needs to be annual, demonstrating the knowledge. So everything that we just talked about. Maintain documentation. So whether you have an electronic means or you have sign-in sheets and then you put them in an Excel spreadsheet, but make sure you're maintaining documentation. And it's not just important to say, oh, Janine Fink Boyle was here on, September 22nd, and check mark for the training. Is that, where's the agenda? Is there a pre-test? Is there a post-test? Is there a PowerPoint slide deck? All of that packet, as you know, is what the surveyors are looking for to maintain documentation. It's not just a check off next to someone's name. And then obviously, as we talked about before, if you are revising policies, you're updating and editing, you're changing, you need to make sure that you're conducting training. So that is important. And obviously, I think right now during COVID-19, that's what you all probably are doing. But just make sure that you document. So let's talk a little bit about more of the linkage with COVID-19 and how things start to intersect with infection control. So the emergency management, there's 5 steps here. And I think that, some of them we can put in front of the other if we really look at where we are today with COVID-19. We started out, the beginning of the year, January, February. I know I had come to Nebraska pretty much the week before everything shut down. And people were using, hand hygiene. They had your alcohol-based hand rubs, your sanitizers. I did see people wearing masks. There was, lots of making sure there was no touching and starting with social distancing, and really kind of that prevention of trying to make sure that you could, that you could mitigate. And so as we kind of moved a little bit, few weeks later, we started really looking at nursing homes preparing and preparing for how they could prepare. So again, that was really looking at signs and symptoms of residents, starting to isolate, looking at using transmission-based precautions, preparing with PPE, and making sure that you had what you needed in order to take care of people that were positive. I know that there's a lot of stories, and I'm sure all of you are also part of them, about not having enough and not having enough supplies to be prepared. But we know that was part of the process. And so, there was response, right? So the response came from the federal government, it came from your state government. Some things were acceptable and some things were not, but kind of where an emergency management, plan is that there is a response. And then recovery. I would say I don't think we're in recovery yet. Different phases in different states as the country opens up, and we have, schools, some schools open, some schools hybrid, some schools closed and all virtual. Some businesses open, some businesses not. I know, as I am here today going through this presentation, visitation indoor and outdoor nursing homes, that, testing. So we're going through lots of the, what we have been advocating for, from national to get to recovery. But here's what the 5 steps are. And we know that through COVID, you've gone through all of them and up to recovery. So the new normal, we know that the new normal really focuses on infection control, and it focuses on your infection control plan and prevention. And so using universal source control, for PPE, you are obviously doing screening. So screening for signs and symptoms of your staff, screening for signs and symptoms of COVID-19 for your residents. And obviously if you're going to be having indoor visitation, you're going to be doing that for any screening that's being done on visitors, any screening that needs to be done on consultants or contractors. Testing, so with the point of care testing machines that came out from HHS, so whether you have a BD Veritor or the Quidel Sofia, and then now the Binax cards from Abbott, so using all of those for your testing plans, again, focused on your community positivity rate. Um, Cohorting, have you created different areas in your organization where you're cohorting positive people and then you have where negative people are, trying to keep the same staff, and then obviously PPE. So these are all the new normal for us. They all are focused on making sure that you have part of your infection control policies and procedures in your plan. That all feeds into your emergency preparedness plan. So again, it's layered upon each other. So the piece that I did leave out, I talked about screening and source control, PPE, cohorting, and testing. So visitation. As I said before, visitation now, having indoor visits or outdoor visits, again, looking at scheduling them, looking at the fact if you have an outbreak. An outbreak is one positive case that you would not be able to do indoor visits, that you need to have 14 days of no new onset cases in the building, different from having an admission, if you have an admission with someone that's positive. But again, it becomes a new normal. So with visitation now, as CMS has moved forward with guidelines and their requirements and the particular memo that just came out, you need to go back to your infection control and your policies and procedures and really put into place how you're going to do visitation and outline it. People that are responsible, supplies that are needed, time limits. I know the weather is going to change. So if you're doing outdoor visits, if you have tents and barriers, and then if you're going to come indoors, there's signage. So again, all parts which links into your infection control policies and procedures, and then leads into your emergency preparedness. So I wanted to put in here a facility assessment because I'm wondering, did everyone forget about the facility assessment and ropes phase 2? But remember, the facility assessment is one of the building blocks. So the facility assessment is where you are looking at the types of residents that you have in your organization. So skilled residents, chronic care residents, all of the different comorbidities that they have, what services do they need, whether it's therapy, wound, bariatric services, and then what equipment that is needed to take care of those particular residents. So if it's certain diets, obviously we're looking at medication carts, and if you're using electronic medical records and armbands and laboratory equipment and so forth, and in this case testing, having your CLIA waiver. So that facility assessment, as you are kind of outlining your organization for resident services and equipment, again, you're using that all hazards approach and thinking about the risk assessments, environment, internal, external factors, community. It all builds together to create your facility assessment. And remember, your facility assessment is part of your infection control plan, policies and procedures in your plan. It helps build what is in that plan, which in turn then builds into your emergency preparedness program. So again, layered, building on each other. So focused infection control survey. As CMS really put the emphasis on infection control to mitigate the spread of COVID-19, they put forth that every nursing home needed to have a focused infection control survey. So some early on before the end of July might have had a desk review or more of an external, but there had to be an internal on-site infection control survey for every nursing home, all 15,400 nursing homes by the end of July. So all of you should have had one. And really the focus, and I'm hoping that all of you took time to go through that critical element pathway. That's what the survey team is using with those. In this case, there are 3 new F880 tags under infection control. But what are they focusing on? 1, you have your infection preventionist. Oh, look, ropes 3 comes back to us, right? So we just talked about ropes 2 for the facility assessment, but ropes 3 was your infection preventionist. I know that there's no surveyor guidance. I know that there's no updated appendix, but we do know that at the end of November of last year in 2019, that phase 3 became implemented, that you need to be compliant with these phase 3 regulations, and one of them was the infection preventionist. So again, it's looking at the infection preventionist, their time, and what's going on in your facility. What are your rates? So again, not just COVID-19, but other infections that you might have. Again, looking at your policies, your procedures, your plan, thinking about everything from not just your line listings, but again, cleaning, PPE, cohorting, transmission-based precautions, really seeing how is everything working in your organization. Obviously they're not just looking at the demonstration of hand washing, but they're actually going to ask staff, Ask staff, what do you do in this case? What do you do in this case? Looking at your training plans. Again, we talked about training earlier in the presentation. As I said, I always say the critical element pathway because that's what the surveyors use to survey you, yes or no. And so that is exactly what you should be doing when you're going to do a mock survey. And then the last part, when they were focusing on your IC surveys through the summer, was really, again, looking at influenza, pneumonia, and obviously COVID. So if you didn't have a positive case, or you didn't have again, one positive case is an outbreak, but let's just say the fact of an outbreak, staff and residents, what was your plan? And so really, wanting to know surge staffing. So if in the case of staff being out sick, or staff having to take care of family members that are sick, and what was your full plan in the case of having residents and having an outbreak? So again, all of that for that IC survey. And obviously, when they were looking at your infection control survey, again, let's talk about another linkage, linking to your communications plan, linking to, in the case of an outbreak, what's your emergency? What would happen if there are another event could be on top of this? So I know I talked a little bit about the regulations. And so we know that there are your infection control reporting tags. They're under F880. The CMS memo that came out for 2029, which was earlier in the summer, actually is the one that focuses on the infection control focus survey. And initially then, as the reporting requirements came out for 884 and 885, this is where the NHSN, so the reporting that you're doing to the NHSN, is a federal requirement, meaning only surveyed by federal surveyors. And then your other survey tag, the 885, is the communication. So again, linking back to, this is under infection control, but it's linking back to your communications plan. So again, linking back to what you've done for your emergency preparedness program. And then, as we talked about earlier, the E-tags. So other areas that you could be non-compliant in have to do with communication, as we talked about testing, training, and drills and exercises. So let's talk a little bit about emergency planning in COVID-19 and really kind of focus in on where there would be areas that you really need to kind of look at as you're doing an annual review, or again, if you're doing any revisions. So you're not just reviewing your emergency operations plan or your continuity of operations, but you're really looking at making sure that what requires any sort of implementation or revision as it's sort of appropriate. So you're reviewing it, you're updating, and then you're training. So we kind of talked about that. We talked about succession planning. So if I'm the person that's going to be in the infection preventionist, is there a backup? Anything can happen. I mean, my family could get sick. I could get sick. I might not be able to work. Something could happen. So what is your succession planning? So again, really important as you are looking to the future. Your clear chain of command. So who is the person that is in the command center? Who is the individual that is leading everyone? Who is the individual that is making sure that you have your roles and responsibilities and that they're carried out? And if there is a decision that needs to be made, who is the person that's going to make it, and where's all the information going to come from? You need to make sure that you maintain awareness. So this is really important because you're thinking about the fact that you're maintaining the awareness of what's going on in your organization, but you need to maintain awareness and updates of what's going on locally in your community and any of your state health departments, what goes on with CDC, what goes on with CMS, what goes on with the World Health Organization, any other professional organization. So that awareness, is there an individual that's really like checking the CDC website on a daily basis? For us, are you making sure that you're looking at the need to know that comes out from Leading Age National? I know that I get your Leading Age Nebraska newsletter that comes out every day. Are you making sure that someone is looking through that and getting the information that's needed? And so by doing that, you're making sure that you are really on top of what's going on if there's any changes, and some of them are daily, some of them are weekly. You're then looking at your current infection prevention practices. So when you have an outbreak, when you have a positive case, are you making sure that you are addressing any practices that might be breached, or any practices that you might need to coordinate new strategies on? And so that that is being done, that you're constantly assessing. Again, we talked a lot about the community and partnering in the community. I know that, you know, during this pandemic, it's not the same, but again, partnering with your Department of Health, making sure, I know that they're always on your Leading Edge Nebraska calls, but making sure that you're getting communication on if there's any changes, things that are going on in the state, whether it has to do with cohorting or escalation or testing strategies. So again, thinking about that on a state level. Identifying any backup systems, so thinking about any framework in the case of systems going down or not having that collaboration, what kind of backup systems would you have, especially looking at information technology, and anything like obviously your health records or any web-based recordings that you're doing, so what's your backup? And then finally, really looking at any crisis or contingency factors. So, you know, considering the other weather events that could happen in your community. So I know we talked about flooding, we talked about severe weather that could happen in Nebraska, but really trying to focus on, you know, what else could go on that you might need to make sure that you're taking control of. So in the area of administrative control, so when we're looking at really linking into your emergency program and your emergency preparedness plan, looking at ways that you can encourage and have your social distancing. So we know that dining is one area. You know, I know that CMS has come out and said that you could have dining with individuals at certain amounts to a table with 6 feet in between them, and people wearing masks in and out and so forth. So, you know, how are you being able to control to make sure that you are you're encouraging interaction with your residents, but you're still making sure that you don't have these like large groups that are not at social distances. And the same thing with activities. So how are ways that you can still have some group activities and have social activities, but again, that you are practicing, you know, hand hygiene, using, you know, masks, have social distancing. Looking at your environment, so spacing common areas. I know when residents want to walk around your neighborhoods or walk around your building, they want to go to a garden room or a library, or just maybe, you know, sit in a different place than on their neighborhood or their unit. You know, how are you making sure that those areas are safe, that the high touch areas are cleaned, that the residents are, you know, washing their hands and so forth, so that do people need assistance? I know that staffing could be a little bit hard on that, but thinking about that. You know, virtual communications. So again, what we talked about was obviously having to report positive cases, reporting testing results, but then reporting when you have positive cases to staff, family, and residents, and how you are doing that and making sure that you are able to really have a stable way to communicate. Again, whether you're using different platforms, whether you're using, I know that I've heard some members that do like weekly Zooms for families. And so, you know, anything that they could do. If you're using telehealth for any of your resident care that's needed, and if that's able to be used. I thought a little bit about the staff break rooms, because I know we've heard from the different strike teams that, you know, kind of individuals come off of the unit and working with the residents, they go in the break room and they, you know, kind of take off their PPE and sit a little bit close to someone while they're eating. And so really need to think about whether you can stagger breaks, stagger meal times for staff if you're able to do that. But if they can't, make sure that there's social distancing. And it's okay for one staff member to tell another staff member. And that, you know, as leaders, we need to make sure that we give people empower them to do that. And then the option for telework. Again, I know in nursing homes, there's not a lot of option for telework, but in some departments there might be, maybe human resources or the business office. And then when you have those virtual meetings, making sure that people are included and have the ability to do voice and not just audio, but also being able to see people. So I think it's important to have that, then also that sense of community. Other areas of administrative control while we're looking at any signage. So again, thinking about signage and the screening process throughout the organization. So, you know, your different entry and exit portals, that those are signed, really looking at your testing and making sure what your testing plan is, and that is being disinfected and is hand hygiene. Again, making sure that work areas are free of any clutter and so forth. And so, you know, when I think about testing, I think about the fact that obviously it's always going to go on your community positivity rate. And so whether you're doing it, you know, once a month, once a week, 2 times a week. And so really having someone that is in charge of that and someone that's in the backup, because you need to be documenting and obviously reporting results. When the contractors and the consultants come in, so someone that might come in once a month gets inserted in the testing plan, but someone has to be on top of that. Someone needs to know, oh, you know, the dietitian only comes in on Wednesdays, you know, for the second Wednesday of the month. And then, so we need to put that individual insert them in the testing plan. But again, you need to have the workspace for that, right? It needs to be like, is there a dedicated area in your organization? Is it clutter free? Or you make sure that you have the right ventilation. You're using the point of care testing machines and you have the supplies that are needed. And then obviously the disinfecting. So these are all different areas that really under the administrative control that you have that feed into your infection control policies and procedures and your overall emergency plan. Just a couple other things about administrative control, and I think I touched on a few of them before. We talked about the environmental practices, you know, really making sure that you have the disinfected and the cleaning, and that, you know, people are reloading any of your automatic soap dispensers, making sure bathrooms are clean, dining areas, staff break rooms, you know, making sure the garbage is pulled, and making sure that when we talk about PPE, so when you're donning and doffing, and so making sure that when they're in your different areas, and then how that is disposed of also. You have to think about workforce exposure. And so, you know, staff that end up becoming positive. And so how that works, again, you know, lots of pieces legally, human resources, looking at the fact about staff being tested. And then we know that when there's refusal and how you're going to work with that. And, you know, I have heard of some nursing homes that have made the testing part of the employment condition of employment. Again, I'm just telling you what I have heard from members, something that you need to work with, obviously, even in administration, your board, your legal team, and HR and so forth. And then obviously you need to make sure that you tell staff. So what are the policies and the expectations? So again, as I said, if there's testing and how that will work, so staff know if we hit the high community positivity rate, we're going to be testing 2 times a week. And so how that's going to work, and then when they need to get tested and what day, and that's, you know, consistent. So again, it's all consistency. But again, part of your testing plan, which becomes part of your infection control program, which becomes part of your emergency plan. Update return to work. I cannot strongly enough suggest to make sure that you do read through the CDC. CDC has some great pamphlets and updates and things you can download and copy and read through when it comes to returning to work, when it comes to particular guidelines specifically for nursing homes. And then the other part about identifying and ensuring staff. So staff that work in other facilities, how's that working? Different social behaviors, you know, again, thinking about with your staff, again, as a leader, just talking to staff about as they leave your organization and what they do outside of your organization, and then, you know, coming back to work. And again, not being a gatekeeper, but it's just something to keep in mind. And then obviously travel. So if I know this was a big deal over the summer, staff taking vacations, going across state lines, and, you know, different states have said, if you come, like I know if you are in where I am in DC and you go to Massachusetts, you need to get tested and file that test and so forth, or you have to quarantine for 14 days. So again, all pieces that you need to think of on the administrative level. And then the operational considerations, really, I think focusing in, again, we've talked lots about communication. We talked lots about education. I talked about staffing before, if there's surge staffing, again, and I think all of you have heard me speak before. I really like to focus on the fact that you need your environmental staff, you need your dining staff, you need housekeeping, laundry, maintenance, though really thinking about those staff also, because in the case of any indirect care, they're the support services of your organization. So how are you going to be staffing? Thinking about supply chain, so working with your different vendors. I have a vendor for X, but then I need a vendor for Y, but then I might need a backup. So really thinking about that and how that feeds into in the case of an emergency and now in the pandemic. If you're doing, you have your CLIA waiver, and so you're doing your point of care testing, but if you're sending out any of your, in this case, if there was any false positives, or you're getting PCR testing, working with that laboratory, turnaround times, and then thinking about when you're getting certain residents treated. So if there's dialysis, if they have to be transported out, for a particular, maybe some cataracts. I'm just kind of thinking, just broadly. And then if there's discharges, so thinking all about that too, because this feeds into infection control. So these could be other individuals that coming into your organization, so screened and tested. You think about the fact that residents going out out of the organization, so making sure that they have PPE and so forth, and then if they're being transported. And then lastly, behavioral health and workplace safety. So really focusing on, I know we've talked a lot about in the last few months, mental health and wellness for staff, whether people can take vacation, whether they can just get a day off, but really trying to work with staff because I can only imagine what you here listening to me talk are going through on a daily basis, but then also obviously all your staff. And then your residents too, the social isolation that they've had for months without their loved ones, without visitors. And so, how are there ways to really focus on that? And that's a huge operational consideration. And then with the infection prevention. And so I think, again, so kind of tying it all back together and looking at your emergency preparedness program. One of those key pieces is obviously, as we said before, your infection prevention plan feeds into it. But really now during COVID-19, everyone talks about airflow and evaluating your HVAC systems, making sure that there is the right airflow in there, understanding how the systems work. Maybe even, as I said at the bottom, getting a formal assessment of them, making sure that there's fresh air intake when possible. When you're using cohorting, that there's barriers, or whether they're temporary barriers, but that you have those particular barriers that you can install. And then anything that would have to have a filter changed. So really looking at your enclosed spaces. So again, we talked a lot about hand hygiene and disinfecting and so forth, but here's the other big piece of infection prevention, and that really has to do with evaluating your HVAC systems and the airflow and looking at the enclosed spaces. So I just put this on here just kind of as a full circle. I left communication as a piece out, and I'll tell you why in a second. But overall, here's all of your preparedness disaster drill. And when I say disaster drill now equals COVID-19. So this pandemic is real life experience. So it's not a drill for all of you. You actually have your real life experience with this pandemic to be using for emergency preparedness. So we talked about surge staffing. I talked earlier in the presentation about your memorandums of understanding. So schools, churches, again, going through those. We talked about the layered effect of having your facility assessment and that feeding into all of your plans and programs. We talked a lot about testing in two ways, right? We talked about testing when it comes to doing, in this case, it would be a drill or a mock, but really, making sure that all of your systems are working, so testing. And where that comes from is that you've trained your staff. And so once you've trained your staff, you want to be able to do testing. And then obviously communication. And in order to make all of this work, there has to be communication. And communication, again, we talked about internal communication and external communication. We talked about communication with your health department. We talked about communication with, communication with your other nursing homes, with survey teams, with the public health, Department of Health or your public health department. But really communication is key. So communication really is the linchpin when you're looking at creating your emergency preparedness plan. And in this case, you're doing an annual update. So I know I keep talking about creating your plan, but you have a plan. So now you're updating it and you're really doing revisions, you're editing, you're fitting in your plan for what you've gone through in COVID-19 and what potentially could happen in the future. So I put a few resources on here. CMS has a great survey insert templates that you can use for emergency preparedness. So does ASPE or ASPE Tracy, which I think is a great website off of HHS. And then I also put on here a guide that Jody and I did for the infection control focus survey. And we updated at the beginning of September when the new testing requirements came forth. And I think that it's a great document in order for you to use when you are focusing on infection control. So again, as we kind of close out here, really looking at, how have you not just prepared for COVID-19, but how are you operating during COVID-19? And you're using all of those pieces, all of your testing, all your training, all your communication. You're looking at all of the controls, so again, focusing on PPE and screening and testing and visitation. So everything that you have all together, you would be creating your infection control plan, right? Working with your infection preventionist, and then that together rolls right into your emergency preparedness program. So I hope that I was able to give you some information today. And from there, I think most of you have my information, but I left my email on here. As it says, don't hesitate to reach out with any particular questions. What we've been doing is lots of different in-services and just answering questions one by one. And I just want to thank all of you for what you do and your staffs, and, right from my heart. So thanks for having me, Leading Age Nebraska. Have a wonderful conference, and I really hope to see you soon.